Electrosurgery is a powerful method to perform medically necessary and cosmetic procedures in the office setting. There are multiple devices on the market with similar uses, though the technology differences may provide different effects when the tools are used. In the outpatient setting, mole removal, spider vein ablation, and telangiectasia ablation are useful skills with this device. A radiofrequency device provides a wide variety of common clinical uses. The device has a variety of tips. Straight wire, loops, and ball tips are needed for these procedures. Cosmetic removals of moles are commonly requested by patients. The first lesion is on a patient's left breast. To assist in identifying the margins of the mole, a surgical marker can be used to highlight the lesion to be removed. This is especially useful for flat nevi, where the margins are not elevated. Place a local block under the lesion and wipe the lesion with alcohol to keep moistened. The block should be placed below the dermis so as not to distort the junction between the nevus and the surrounding dermal layer. Use the 1/4 inch loop tip on the radiofrequency scalpel to carefully excise the mole to the dermis. For the initial passes, the cut mode is used for the removal of the bulk of the mole. For the fine passes near the base, the device can be switched to the cut coag mode to provide fine coagulation for hemostasis. The loop pencil is handled very lightly to avoid excessive depth of excision. Use a light brushing stroke to remove the mole layer by layer. The entire lesion is removed using the loop device in this case. The second case involves the removal of a forehead lesion that is well demarcated at its base, so a surgical marker is not used. The local block has been placed and is visible by the blanching of the skin around the base of the nevus. Use the 1/4 inch loop tip on the radiofrequency scalpel to carefully shave the mole to the dermis. For the initial passes, the cut mode is used for removal of the bulk of the mole. Shave off 1 to 2 millimeters of depth at a time initially, then begin to make even thinner cuts as the base of the nevus is approached. Once only a small remnant of the nevus is left behind, the tip of the pencil is switched to the small ball tip to coagulate the remnants of the mole lightly. After each layer is coagulated, wipe the area with gauze firmly, which removes the layer that was just coagulated. After repeating this 3 to 4 times, the nevus is fully eradicated and only the surface of the dermis remains. Perform one final coagulation of the base of the lesion for hemostasis. A very cosmetically pleasing result with minimal scarring can be obtained using either of these two methods. The latter is more precise, and physicians may find that using the ball coagulation finish provides the desired precision for high cosmetically sensitive areas. Post-operatively, the appearance is quite pleasing. A radiofrequency electrical surgical device is an excellent instrument to ablate spider veins. The ability to coagulate small veins with this instrument is enhanced by the radiofrequency wave technology as well as the minute size of the wire tips. Place the patient in a comfortable position with the spider veins exposed. Cleanse the overlying skin of the veins with an alcohol wipe. Set the device to the coag setting at the lowest power setting needed to pass through the skin. At this power level, no anesthesia is required. The patient will feel a small pinching sensation with each activation of the instrument. Place the fine wire tip relatively perpendicular to the skin over the vein. Apply slight pressure with the fine wire tip on the skin. Activate the device using the blue coag button, preferably with the foot pedal to avoid movement of the hand. Upon activation, the fine tip dives into the dermis into the vein, inducing coagulation of the vein. Whenever possible, ablate junctions where the veins branch first, then repeat ablations along any remaining veins that are still visible. Often 2 to 3 coagulations are required to ablate moderate-sized spider veins. For larger complexes of veins, as in this patient, 10 to 15 passes may be needed to eradicate the full complex. With larger veins, immediate blanching will occur, but maximal fading of the veins will occur 1 to 2 weeks after the procedure. Telangiectasias can be ablated easily with electrosurgery. The ability to coagulate telangiectasias with this instrument is enhanced by the radiofrequency wave technology, as well as the minute wire tips that can be used for this procedure. Place the patient in a comfortable position with the telangiectasia exposed. Cleanse the overlying skin with an alcohol wipe. Set the device to the coag setting at low power. At this power level, no anesthesia is required. The patient will feel a small pinching sensation with every activation of the instrument, but it is well tolerated. Place the fine wire tip relatively perpendicular to the skin over the central vein of the telangiectasia. Apply slight pressure with the fine wire tip. Activate the device using the blue coag button, preferably with the foot pedal to avoid movement of the hand. Upon activation, the fine tip dives into the dermis into the vein, inducing coagulation of the vein. Once the central vein is ablated, retreat any areas where there are any veins that did not coagulate immediately. The results are immediate, and the patient does not need any special wound care.